Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Sadchar, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you're in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Today, we're honored to welcome Dr. Melvin Speisman, MD, FACP, FAIM. Dr. Speisman is a board-certified internal medicine physician with over 25 years of experience in patient care and medical education. He has devoted much of his career to training and mentoring medical students and residents, earning numerous teaching awards and recognition as a lifetime member of Alpha Omega Alpha, which reflects his commitment to excellence in patient care, professionalism, and leadership. Dr. Speisman completed his undergraduate studies at Northwestern University, has earned his medical degree from the University of Illinois College of Medicine at Chicago. He trained in internal medicine at the McGraw Medical Center of Northwestern University and the West Suburban Medical Center, where he also served as a chief resident in internal medicine. In addition to his clinical work, he has held long-standing faculty roles in residency programs, guiding the development of future physicians and preparing many for leadership programs. In recent years, Dr. Speisman has expanded his focus to the role of artificial intelligence in healthcare. He has pursued advanced education in artificial intelligence and healthcare through programs at Harvard Medical School, MIT, and Northwestern Kellogg, and he is now furthering his studies at Stanford University. Today, he serves as the president of the American College of Artificial Intelligence in Medicine, an organization he founded to advance the safe and responsible use of AI in healthcare. Just 2 weeks ago, the college hosted its 2025 scientific session, which brought together leaders from medicine and technology to explore the opportunities and challenges of AI in clinical practice. Dr. Speisman, it's a privilege to have you with us today. To begin, could you share a little bit about what inspired you to establish the American College of Artificial Intelligence and the vision you had for this organization when it began?
Well, wow. Thanks, Hargan, for such a lovely introduction. That was so kind. While I was at the University of Illinois College of Medicine as a professor recently, I started to get invited to some sessions that were on what we call the East Campus, which is the computer science department. And this was designed to bring physicians together with computer scientists. It was actually hosted by the chairman of neurology, who was really involved with data science and really had a like $5 million grant to oversee all the healthcare data for research purposes at the institution. And so these sessions were held regularly, and I got to know the head of computer science department and many of the faculty that were interested in doing healthcare research. And then the head of biomedical engineering and faculty in his department that wanted to work around AI in medicine. And then I met with the informatics physicians and on and on. So I realized that this notion of doing AI as a tool for patient care really required a collaboration between computer scientists, biomedical engineers, informatics experts. And they kept bringing in really great speakers for grand rounds or special dean's lectures from some of the greatest places, and I got to meet some of the leaders in the world who are really at the forefront of AI in medicine. But one thing that came clear to me is there wasn't really an organization or a place where we could all collaborate. The computer scientists have their professional societies. We as physicians have our professional societies. I've been a member and a fellow of, it's called American College of Physicians, one of the oldest medical professional societies in the US. It's 110 years old. And I've attended that conference and participated very actively in that organization for 30 years. So I thought, let me make a mini version of this American College of Physicians, but we won't just have it for physicians. We'll include anyone that can impact AI to improve patient care, whether it's computer scientists, biomedical engineers, healthcare leaders, because a lot of the implementation of all of this requires input from those who lead healthcare systems. So it's a very collaborative project, if you want to call it that. And the thing that makes it different than everything else that's going on in AI is it's not a business. We are a non for profit professional society. And our conference that you mentioned, that we just held our first annual scientific session in Chicago at McCormick Place, it wasn't an industry AI conference like all of the rest. It was a true scientific session, influenced by industry, and it was about advancing and improving patient care using evidence based medicine, looking at the studies, not the hype. And there's tons of AI conferences, probably one every day all over the globe, but they're all marketing and hype and industry, and they're not about the research or the science. So I'm basically modeling our organization after American College of Physicians. When what's interesting is when that was founded 110 years ago, they modeled it after the Royal College of Physicians, which was founded in the UK 500 years ago with the intention of improving patient care by establishing really high standards of excellence. And so essentially that's what we're doing, setting a high bar of excellence in teaching other physicians and collaborating in research and education with anyone who is interested in. And what I can tell you is, I know we chatted beforehand and you're on the pathway to medical school, but there are many who are at, for example, Carnegie Mellon or MIT or Stanford, that their intention is, instead of taking that path to medical school, is to do their computer science combined with their healthcare training. There's a lot of biomedical informatics departments. Almost every university has one. And they plan to do what I described, which is to collaborate with someone like me, a physician, to try to impact patient care that way. And so this is very much needed in 2025, as you know. And that's why we're having this conversation today. But our organization really is driven by this idea of AI for good, or making the world a better place, and reaching out to, for example, countries that might be not having good access to care, or parts of our own country where maybe regions or areas that don't have good access to care. And I know that equity is an important part of what you're doing as an organization, and that's a big part of AI in healthcare. And I know we're going to talk more about what measures are taken by people like me to like promote that. So I'll turn it back to you, Hargan.
Awesome. Thank you so much for sharing. That was incredible. So, as you mentioned, we'll start to focus a little bit about your path towards AI. Your background in internal medicine has given you decades of experience as both a physician and an educator. How do you think that this has shaped the way that you think about patient care and the future?
Well, I really would like to link that to how it relates to deploying AI. And the reason I say that is, in the last year, AI has been deployed in most primary care settings in the form of ambient listening system, or writing a response to a patient's question on the portal system. So it's already implemented, and a lot more AI tools are being built. But where I'm going with this is simply, if a computer scientist builds an AI tool for healthcare without the input of a clinician like myself who has had years of experience, the tool they build may not be relevant to the care. So we need physicians who have years of experience, who know where the roadblocks are in the system, who know where the problems are for patients to get the access they need, to be involved in how these AI tools are built by computer scientists. That's why our organization is very collaborative. If you talk to anyone who's a leader in AI in healthcare, they will tell you that the clinical experience that one gets is critical to kind of blend or mesh with at the time that someone is building an AI tool. And so, um, if you would have asked me 20 or 30 years ago or predicted that I would be doing this, I would not have known that. But all of us who are practicing physicians need to really be skilled at using artificial intelligence starting now and into the future, or we will not be effective in caring for patients. And so most of the things that have been problems in medicine that have not been easy to solve can now be solved if we are willing to embrace AI as a tool to problem solve. So, and that's not just true in medicine, that's true in law, it's true in business, it's true actually in every aspect of people's everyday lives. So, it doesn't matter whether you're in healthcare or what it is that you do, if you don't learn the new methods of AI, you won't be effective in whatever it is you do nowadays. And so that's kind of my big picture thought. I didn't maybe focus as much on my clinical training as you hoped for, but I think it's more, how does the clinical training link into where the future of medicine is going?
Definitely. Thank you so much. And then that was a perfect segue into the next question I had for you. Many physicians in the current time period are still cautious about new technologies. So, what convinced you that artificial intelligence was not only relevant, but essential to the future of medicine?
Wow, that's a good one. Thank you. There is a lot of hesitancy. People are cautious. And the reason is that when we are in medical school and about to launch to be independent in practice out of medical school, we, for thousands of years, have taken this oath to do no harm. It has been passed on from generation to generation since the ancient Greek times, that as a physician, this has been withstanding centuries, is we don't ever want to do anything that might harm a patient. Every doctor lives by that mantra, so to speak. So we are all cautiously optimistic about, some are just skeptical and don't want to embrace it, but even those like myself who are trying to teach others about it, there's still a caution, because until it's tested, we don't know if it's safe for a patient. And so let me give you this scenario. You or I wouldn't prescribe a medicine to a patient unless it was in a randomized trial, and that study showed that it benefited the patient, that it improved their care. That's the standard that the FDA holds for pills. And that's, everyone goes by that, right? That's just, any practicing physician feels obligated. They would want to see the data. And the FDA won't even release the drug for use unless they see the data. So they're protecting the public. The same kind of rigor does not apply to AI algorithms. The FDA has a process of approval, but it's not the standard that is upheld for drugs. And you could potentially get approval for a tool for helping patients that's AI algorithm tool, and it may have FDA authorization, but until it's tested in a rigorous way and we can show that it really is going to help you if you're my patient, we should be at least cautious about it. But I kind of like the term cautiously optimistic. So our conference, the one that we just held and we're going to hold annually, we present the studies, the papers, the science that exists around different AI tools. And we would only recommend one to our to our membership and to those following our lead if we can show that it's been proven to help patients. Whereas if you go to an industry sponsored conference, they made the thing, they're trying to sell it, so they may not have such a rigorous safeguard as we would at our conference or in our organization. So that's kind of my take. I hope that answers your question. I may have gotten a little bit off of the track. If you want to redirect me, you can.
At all, that definitely does answer our question. Thank you. And now we'll go a little bit more about the building of the American College of the Artificial Intelligence in Medicine. So let's talk about it. What inspired you to establish the American College of Artificial Intelligence in Medicine? I know you discussed this briefly previously, but what role do you hope it fills in healthcare?
Great. So within every specialty of medicine, there is at least one and sometimes two or more professional societies. I'll give you several good examples. Let's talk cardiology. If you were done with medical school, done with residency, and completed 3 to 4 years of cardiology fellowship, that's a long time, you would join two organizations. One is called the American College of Cardiology, and the other is called the American Heart Association. And then if you subspecialize even further within you might join another organization that's like the Echo Society or an interventional society. So my point is, when doctors finish their training, they're done with the medical school, they do residency and fellowship, and they're a subspecialist typically in one area that they're truly an expert in. Once they reach that point in their career, they continue to maintain a standard of excellence and stay up to date in their field by becoming a member of their professional society, going to an annual meeting, and at that annual meeting, learning everything that was new in the last 12 months so that when they're 10 or 20 years out of their training, they're still up to date. So we call that continuing medical education. And so that's what happens with every field within medicine. I gave the example of cardiology, but say in gastroenterology, there's the American College of Gastroenterology and the American Gastroenterological Association. So there's typically two or more professional societies within each specialty of medicine. Well, nothing really like that exists for AI in medicine yet, but it was clear to me that now was the time to do that because we have many people, physicians and others, that are all working now on AI for healthcare. So it seemed clear to me that there was a need for such an organization. And since as you mentioned at the beginning, my career is all about medical education, whether it's medical students, residents, or faculty for CME, it was like crystal clear that I had to do this because it was needed right now. And so I created basically a professional home for anyone that wants to work on AI in healthcare. And there are some other organizations that are along those lines, but none that are doing it in the form of a college the way we're doing it. So I'll give you an example of an organization that also is kind of similar and's been around a long time, and it's an informatics association. The informatics is really relevant to all of this, but there's more to the AI in medicine than just the informatics piece. And those are just some subtleties that we certainly can get into. But anyway, hopefully that gives you some sense of why I formed the organization. And, there are some other organizations that are out there. A lot of them are more industry-focused organizations. There's a lot of major conferences, but they're all industry-focused. So I really wanted something that's purely unbiased, nonprofit, educational. But it's not any different than the cardiology organization, the gastroenterology society, ASCO, which is the Cancer Society, which I'm a member of, RSNA, which is the Radiology Society, which I'm a member of. So pretty much every physician specialty has a society that's just for their own benefit to keep education and knowledge going, research, teaching, education. And their main highlight for any of these organizations that I mentioned is their annual conference, where thousands of doctors come to a massive convention center from all over the world to meet each other, to share their research findings, to have educational lectures. So what I'm doing is very similar to every one of these other professional societies. It's just that this whole AI push being so relatively new, there was a gap, basically, something that I feel like I'm filling an important gap right now, given where all of this has gone.
Definitely. Thank you. And we're very excited to see where the American College of Artificial Intelligence and Medicine, how it will scale in the future, and the society that is going to be made as to come. So you recently hosted the 2025 scientific session. What were some of the key themes that stood out to you, whether that was new clinical applications to AI, questions of ethics, or areas where physicians and data sciences still need to bridge the gap?
Right. So, as I mentioned, our main purpose at the conference is to present the most important papers published for example, in New England Journal of Medicine AI or JAMA in the last year. And we did that for each specialty. We had an update in, say, cardiology, pulmonary, critical care, nephrology, and so on. And then we had several keynote speakers that kind of gave a more big picture of governance in AI or just some of the cutting edge thinking in AI. And then, as you brought up, I did invite a professor of law from the University of Florida, Barbara Evans, who's just a brilliant person. She has published heavily on what you mentioned toward the end about, the ethics, the equity issues, ethics. And then we also had someone do things relating to the governance piece, which is important because we had talked about we need to rigorously test these things before we make use of them. So that we had about 23 talks over 2 days. We had 2 rooms going simultaneously. In addition to that, we had a panel discussion, which was a professor who was chairman at the University of Miami in radiology and chair of informatics from University of Utah, Yves Lucer, who's been doing this stuff for like many, many years. And then we did have a workshop, 2 faculty from California that did a workshop on AI tools that was much more hands-on, that was very well received. But the part that I find most exciting is our research competition. And we had a faculty section, really great faculty presentations. We had a resident section. And the part that's near and dear to my heart is we had our medical students and then our college students, and then the coolest is our high school students. And like many major academic centers, we this year hosted a summer high school research internship program. And some of those students came live to present on stage at McCormick Place. So that was really cool. These are really brilliant students that I've been mentoring this summer. So for me, the research part is the most exciting, to see the groundbreaking work and see people that are still in, academia as a student doing really cool things. And I'm very hopeful, seriously, Hargan, that you will join in our research program and do a cool project. Some of the members of Project Unity, the way I got connected with them is I'm their research mentor for some amazing AI and medicine projects that they're doing out in Texas.
Awesome, definitely. And I hope to do that as well. We'll focus a little bit more about your promise to AI ethics and equity. Artificial intelligence brings great promise, but also significant responsibility. How do we ensure that these tools are safe, equitable, and built to reduce disparities rather than widen them?
Great question. Always at the forefront of every talk or conference. So what I can tell you is that in this journey that I've had over the last several years, building the organization and connecting with leaders throughout the world, what I can tell you is this, that those physicians that are building these AI tools recognize that before they build the tool, before they train the model, they need to anticipate and plan for and correct for anything that might be considered bias or inequity. And the way you do that is the training data that you use, you need to make sure it's of diverse populations, not just one narrow group. If you build and train a tool on just a narrow population, and then you say, oops, it's not working well, and you go back later and try to fix it, that doesn't work. So I'll just want to reassure you, even though people are still doubtful, that those individuals that are building these tools have taken equity and bias into consideration before they even start the process and do everything that they can to anticipate it. And even once the tool is being tested, to try to evaluate for any inequities or biases. So it tends to be really the focus of the work that people do on AI. It really is. And it's often the primary focus of many people's work. I can think of many leaders in the field that are doing this cutting edge work, and their focus tends to be on bias or equity issues. I can think of many that like literally fly from conference to conference like ours. They're like on the plane to the next conference. I know many that are like, they're like, I gotta go. I'm gonna fly to Switzerland now to talk about, bias and equity. Like, I can think of many that just they're hopping from one national or international meeting to the next, talking specifically to your point about how do we build tools that are fair and equitable. The other piece that I think is interesting is that in the world of ophthalmology, we can diagnose and treat eye diseases just from a photograph of the retina, but not specifically only the eye, but systemic diseases like diabetes or Alzheimer's or Parkinson's. But the reason I tell you that is a really cool physician who was at Google and is now at Apple. Her name is Lily Peng, and another professor of ophthalmology who's at Iowa, Dr. Abramoff. They built these AI tools can read a photograph of the eye. And why I'm telling you this is that in rural areas of India and Thailand, Google and Lily Peng's group deployed these tools and screened for diabetes and prevented blindness in people who otherwise would never have the chance to see an eye doctor. And so I think that's an example of how we can provide care using AI to maybe some areas of the world that don't have the kind of access to medical care that maybe you and I have here in the US. So I think that's a really cool story. And that was just kind of a fun project she did at Google. And it turned into a major breakthrough. And that was like in 2018 or in that era, but those are still being published, and they've continued. Google has continued to deploy these tools in underserved areas of countries. And I only mentioned that because at the beginning you mentioned that that type of thing, it seems like it might be of value to you, and it is really important to me in the work we're doing here at the college.
Absolutely. And that was super interesting. Thank you for sharing that story. And then to go further, what areas of AI do you believe are ready to make a lasting impact today? But what areas do you think still require more development before they can be integrated into daily patient care?
So the ones that have been integrated into daily care, we kind of talked to in the beginning, which is most of what's been implemented in the last year is ambient listening systems that write the note when you go to a doctor or reply to your questions online. And in radiology, currently the FDA has well over 1,000 FDA approved algorithms, but 75 or more percent is in radiology. So radiologists have really taken this AI tool and really tried to make use of it in a good way. But you ask, well, what are the next frontiers? Cardiology is the one a field where the potential is amazing, but only about 10% of the tools are in cardiology. And I think that the potential to reduce morbidity and mortality in cardiovascular disease using AI is tremendous. But we're just kind of at the beginning stages. I don't really see that deployed at the scale that you mentioned, that radiology is deploying it at scale. Cardiology, the studies are there. They're really good, but we need to get that kind of implemented because cardiovascular disease is one of the major causes of morbidity and mortality in the world. The other area that's a major morbidity mortality where there's attempts at deployment now is in oncology. So I was just at the oncology meeting a couple months ago. I mentioned to you it's called ASCO, or American Society of Clinical Oncology. The focus of this year's conference was AI deployment. The keynote speaker was from Google. Many of the sessions were about how to use AI for precision oncology or being more precise with cancer care. So that's something that you're going to start to see implemented, but it's still also kind of really in the early stages. So, and then anything other than what I mentioned in any other field, there's literally 1,000 papers a year or more, but not any deployment at all or minimal. So one area that's really up and coming that's going to be massively impactful in all of this is in pathology. So the pathology community knows how to do artificial intelligence for pathology. We call it digital pathology. But very few hospitals actually have digital pathology. They still have all their pathology on slides, like physical slides. So once the healthcare system in the US digitizes pathology, that's going to be a massive breakthrough in terms of your patient care, especially in oncology, but in all areas. I think these are the things where we're starting to see significant breakthroughs is cardiology, pathology, and oncology. And then the rest of medicine, I could tell you that, it's just people that are doing the research part, like in our organization, but there hasn't been robust deployment outside of the things that I've told you. But certainly there are efforts in that direction. What happened is they took the thing that was maybe I don't want to say the easiest to do, but the one that wouldn't be the as risky. It would just be something helping in general, which was the ambient listening, because that's not really making a medical decision. It's just reducing the burden of what goes on in the day-to-day visits. The other things that impact on survival have to be rigorously tested, so that takes time. There's usually a significant delay. In computer science, things move really fast. But when I mentioned about the whole notion of making sure it's safe, the part about testing it and making sure it's safe, that can take some time. Patience is required to ensure safety. Let's just put it that way.
Well, thank you so much for sharing that. And then, aside from your involvement in AI, you have mentored many students and residents over your career. What qualities do you believe are the most important for the next generation of physicians, leaders to cultivate?
Well, physician leaders, what's tending to happen, this is very common throughout the nation right now, is that someone will do their medical school, their residency, and then if they're really into computer science and want to do something in leadership, people are really aware of this idea of an informatics fellowship. I think it's a 2-year program. Typically, there's about 50 programs in the nation. And the reason I mention that is typically those who complete that, right? So they're just literally right out of their residency training, did a fellowship in informatics. Often those are the people that are taking on what we call C-suite leadership positions at hospitals, because every hospital and health system is really focusing on how to properly use computer systems, informatics, and artificial intelligence to problem solve. And because this is so prominent, many people that don't just want to do clinical care, those that want to get involved with a leadership in a healthcare system, will often take this pathway, especially if they're interested in computer science. So obviously there's a lot of other pathways towards leadership, but that seems to be at least trending right now. It is very common to see that pathway for those that want to be involved with leadership, do a lot of computer science and AI work. And so what that job tends to look like is their contract with the health system is a certain number of hours of patient visits just in the clinical setting, like in an office setting or a hospital setting. We'll just say it's called 0.5 FTE, which means a half of your full-time salary would be in patients. And then the other, say, 0.5 FTE, you'd be doing administrative leadership work around informatics, improving the system, maybe deploying an AI tool or solving a problem in the system using informatics and data science. So what we're seeing is the emergence almost in every major health system of what's called a chief AI officer that helps decide which of these tools should we deploy in the system. And so that's kind of the picture I'm painting of the new type of physician leader that's emerging in 2025. At least that's what's trending right now.
Awesome. Thank you. And then before we wrap up, I'd like to ask you a few reflective questions. What are some guiding principles that shape your work and your life today?
When I decided to do this work, it was very clear that I wanted to do it in a non-for-profit way that is sincerely trying to make the world a better place. So this notion of AI for good, and with the real mission of mentoring the next generation, whether it's high school students, college students, medical students, residents, and even more importantly now, faculty, because there's so many faculty that I meet with every day that are practicing clinicians, that we kind of talked about, they have so much to offer with their experience, and they want to learn to use AI as a tool to help better care for their patients. So aside from all the mentoring I'm doing with students at all the different levels and the research projects and teaching, we have a really robust faculty educational program. And so I'm equally rewarded mentoring a high school student, a college student, or a faculty member that's been practicing for 20 years but wants to, in the next 20 years, be really skilled at AI. And I guide them on which certification programs to take and what educational resources they should use. And podcasting, as you know, in the post-COVID era, is the primary way that people learn new things. And so we have our own podcast that we put out every 2 weeks for the American College of AI and Medicine. It's teaching you the latest things in AI. And you guys have your podcast, so I tend to learn myself while I'm doing something else, whether it's exercising or some other activity, but driving somewhere, I'll have an AI educational podcast on. So I'm always learning the latest things. And then I share that with faculty that are in our organization. So if anybody wants to become a member or a fellow of our organization, and go to our website. It's www.americancollegeaim.org. It's org because it's a non-for-profit. And you can sign up to be a member or go on the path to fellowship. If you're a student or a resident or still in training in some way, we don't charge anything ever for membership, for conference attendance. And that's because we're truly committed to medical education. So when you asked about what's driving me, it's the nonprofit mode. I'm not trying to profit from AI. I'm trying to help patients, and more importantly, mentoring the next generation like yourself on how to be the best doctor you can be and use AI as a tool to really make a major impact on patient care.
Thank you. And then, Dr. Speisman, what message would you like to directly share with the next generation of healthcare leaders?
The main message that I have is view AI as your medical student, meaning it's a powerful tool that can help you, but you always have to supervise it. Don't just click and sign yes to things. You have to keep your brain working and be a critical thinker at all times. And don't assume that the AI hasn't made a mistake and that you could just automatically just sign off on stuff. I supervise residents and students at all levels, but that means I check their note. I go into the room and I see the patient and talk to them myself. And if everything is good, I can sign off on their plan, or if it's a student, I have to sign their prescription with my name on it. If you're signing a note written by AI, whether it's or a message you're sending to a patient, or if a decision point is being suggested by AI for patient care, use critical thinking. Keep your brain active and challenging whether this is the right thing to do or not. That is our role in overseeing it to make sure that we do the best for our patients. So my message is always supervise AI. Think of it as your medical student if you're a practicing physician. That means you check everything before you sign off on it. That's my main pearl for everyone out there. If you do that, then you won't be afraid of it. You'll use it well. You'll use it to the benefit of mankind. So those are my final thoughts.
Thank you for sharing that. And then, Dr. Speisman, thank you so much for sharing your experience and vision with us today. Your leadership through the American College of Artificial Intelligence and Medicine is helping guide the responsible integration of AI into clinical practice while preserving the human core of healthcare. So we are truly grateful to have had this conversation with you, and we hope today's episode sparked reflection and affirmed that youth voices and mentors together are essential to building a more just and responsive healthcare system. If you're ready to take that next step, visit projectunitynfp.org to connect with changemakers, explore student-led initiatives, or get involved with future episodes. I'm Hargun Sachar, and on behalf of Project Unity, thank you for listening. See you next time on On Call.